Good morning, everyone. This is Dr. Susan Marra on Dr. Marra's Medical Minutes. And this is Juju. Juju's big now. Juju's almost 9 months. She's doing very well in the office. She's learning how to be a great office dog, and she's happy. So, alrighty. So today we're going to talk about the use of red light therapy in autoimmune disorders. So red light therapy encompasses the red area of the light spectrum, which is about 680 to 1070 nanometers. And it's red, near infrared, and far infrared. And essentially what they do is the application of red light very much affects the mitochondria. The mitochondria are the powerhouses in the cell, and they make ATP. On the fourth complex, complex 4, there is a molecule known as cytochrome C oxidase. When light hits that, it acts as a cytochrome. A cytochrome is something that transmutes light energy into a different form of energy. So the cytochrome C oxidase transforms red light energy into ATP, which is the energy used by the body. When there's more ATP, then the immune system can fight better. What is autoimmune disease? Autoimmune disease is when the immune system is actually attacking itself. Generally, we see in autoimmune disease, there is an infection and inflammation that is driving the autoimmune disease. Lyme arthritis, psoriasis, lupus, Sjogrens. These are all seen in tick-borne illness. And it's largely because if you look carefully, there are organisms in the tissues that are sort of camouflaged, if you will, but not enough for the immune system not to sense that something foreign is there. And so the immune system mounts a response against those tissues, so it looks like an autoimmune disease. So red light basically interferes with the inflammatory cycle, okay? And it prevents certain proteins that are involved in the inflammatory cycle from taking hold. And so by preventing the inflammatory cycle, the tissues calm down and they're not as reactive. And then by treating the infections, you begin to see the ANA titers go down. You begin to see the dry eyes go away, especially in Bartonella. And psoriasis, you have to take wheat out of your diet and put a lot of fish oil in. And generally, we see great results, especially when you use methylene blue. So red light, we talked about this earlier, red light and methylene blue, they work great together, but you have to use a lower dose of methylene blue. But methylene blue and red light therapy, photobiomodulation, is a great way to treat autoimmune disorders. And it's not that hard, and it doesn't make you feel terrible. So I would highly recommend that you look into this. And I think it's a great viable option for treating autoimmune disorders if you don't want to take antibiotics if you have tick-borne illness, which most people that have autoimmune illness, they do have tick-borne illness, but it has to be identified. So the establishment doesn't agree that most autoimmune disease is caused by an infection, but they're wrong. So I hope this information has been helpful to you. Juju's just taking her little morning nap. Such a big girl. Such a big girl. Say bye-bye, Juju. I wish you well. Bye-bye, everyone. Have a wonderful day.